Chapter 29 Examination of other specimens from the intestinal tract and the urogenital system. The outline of this chapter includes examination of pinworm, sigmoidoscopy material, duodenal contents, urogenital specimens. The aims of this chapter include learn the techniques for diagnosis of pinworms, know how to process sigmoidoscopy material aspirates, and duodenal contents. Get information about duodenal capsule technique, know how the main findings, and how to diagnose parasites in your urogenital specimens. We will concentrate on the examination and diagnosis of Enterobius vermicularis, and for that we have to look for other diagnostic methods or techniques. Here you will see the Enterobius vermicularis worm and the egg. Diagnosis of Enterobius vermicularis depends on finding the typical eggs. These eggs are easily to be identified by its unique morphology. The eggs, as we just seen, they have thick shells, football shaped, and it's easy to be identified under a microscope. So these eggs are embryonated and they are infective within a few hours after being deposited. People who suffers from Enterobius vermicularis infection, they have pneumonitis, and this is due to the migration of female worms to the perineal region during the night for laying eggs. Children are more susceptible for this infection more than the adults. Scotch tape as well as anal swabs are widely used in the anal region and before the patient is going to the bathroom. To consider a negative specimen, at least 6 consecutive negative slides should be observed before the patient is considered free of infection. Sometimes the adult female could be seen under the microscope on the tapes or swabs. This is to show you how to collect samples using the adhesive tape. So in this case, the adhesive tape should be prepared and pressed on the perianal region of the patient and then fixed on the slide. To collect these samples are very easy, but again, it should be carried out before the patient go to the bathroom. Sometimes, and in cases of MPSs, uh, it has not been possible to detect this disease by the classical and routine fecal examination. So in this case, sigmoidoscopy material should be a good choice. And these materials should be handled and processed immediately since they are very little and should be handled properly. So other options could be used like immunoassays, the use of immunoassays to detect and differentiate between Entamoeba histolytica and Entamoeba dehiscens. The same thing for other infections um, with uh, Giardia, for example, Giardia lamblia, Oncolytis osteochondritis, or Cryptosporidium species. These sometimes in the routine stool examination may not reveal the presence of any organisms. So in this case, duodenal drainage uh, is required and should be examined as direct with smears or after concentration. The duodenal fluid may contain some mucus, and this is where organisms, particularly Giardia, tend to be found. So these kind of specimens should be handled with extreme care since they are, as we said, very little, um, and also should be examined immediately. Parasites of ecological importance. Actually, we're talking about Trichomonas vaginalis and Onchocerca volvulus that causes filariasis, Schistosoma hematobium, which causes schistosomiasis. So in wet smears, uh, we can see motile tophozois of Trichomonas vaginalis. We can see the larvae of Onchocerca volvulus. While in Schistosoma hematobium, we can see the eggs of. To identify Trichomonas vaginalis tophozoids, the vaginal and urethral discharges, as well as prostatic secretions and urine sediments should be examined. The technologist should prepare multiple specimens before the patient is before the samples is declared um, as negative. So these samples should be processed and examined under the microscope with a drop of saline. Um, Trichomonas, in this case, in positive samples, Trichomonas vaginalis tophozoids should be seen under the microscope, especially under high dye power. Stained smears are not needed, are not recommended to avoid any false positives or false negatives. Trichomoniasis is considered a sexually transmitted disease. Uh, there are other methods for diagnosis. Those relied on the use of PCR. This method is an excellent method since the specificity and sensitivity of PCR is around 100%. If compared with the other classical diagnostic methods like the wet preparation. For filariasis, the occurrence of microfilaria in urine has been reported with increasing frequency in Onchocerca volvulus infections, especially in Africa. So the technique that is recommended is the triple concentration technique. By this technique, recovery of microfilaria is possible. And for schistosomiasis, uh, schistosoma hematobium eggs should be covered with filtration. The urine sample is collected in a container and with a syringe, up to 1 ml of urine is drawn and then filled additionally with air. The urine inside the syringe is ejected through a filter, and then the filter uh, should be examined under the microscope with a drop of 0.85 percent NaCl. So that's all for this chapter. See you again for the next chapter.